Everyone, today is August 22nd, 2020. And welcome to the Board of County Commissioners. The Board, I will read the public charge. The Board of Commissioners ask its members and citizens to conduct themselves in a respectful, courteous manner, both with the Board and fellow citizens. At any time, should any member of the Board or any citizen fail to observe the public charge, the Chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the Chair will recess the meeting until such time that a genuine commitment to the public charge is observed. Are there any agenda adjustments, Commissioner? Hearing none, we will move on to announcements from our clerk, Ms. Wallace.
Good evening, Commissioners. I will read the announcements that are posted in tonight's agenda. Some of the websites I will not read, however, the link is available on our website. DECO Public Health COVID-19 Vaccination Clinic Hours. The walk-in COVID-19 vaccination clinic at the Durham County Department of Public Health, located at 414 East Main Street, have the following hours for your vaccine: Monday, Wednesday, Thursday, and Friday, 9 a.m. to 4 p.m., and Tuesdays, 9 a.m. to 5:30 p.m. All doses are available, and please note clinics are closed between 11:30 a.m. and 1 p.m. daily. Please call 919-560-9217 for additional information or visit our decopublichealth.org website. Children's vaccine events from Durham County Department of Public Health. The Durham County Department of Public Health wants all children in our community get caught up on vaccinations required for school. They will be holding a childhood vaccination days, at the Human Services Building on Thursday, August 25th, and Thursday, September 15th. Vaccines given at Clinic 6 on the first floor. Please contact 919-560-7608 to schedule an appointment. Next, Sheriff speaks on August the 23rd. On Tuesday, August 23rd, Durham County Sheriff Clarence Burkhead will host the Sheriff Speaks with Durham County about keeping our kids safe. What do parents need to know? All residents are invited to attend the community meeting at Southwest Regional Library, located at 3605 Shannon Road, at 5:30 p.m. Other speakers will include Dr. Felicia Gibson, Child and Family Psychology, Center of Child and Family Health, and Lieutenant Jay Carden, Durham County Sheriff Officer, SRO Supervisor. DECO Library Job Fair. Join the Durham County Library for a job fair for our adult community on Wednesday, August 31st from 10 a.m. to 2 p.m. We've invited a wide variety of local employers to meet with job seekers in person. You can discuss open positions, the application process, and even have on-the-spot interviews. For additional information, you can contact Natalie Killian at nkillian@dconc.gov, and there's also a website, a link on our Durham County Library page. Sprouting Connections, Season Extension and Seed Saving. Summer may be ending, but that doesn't mean your garden season had to be over. Join the Durham County Library and Durham County Cooperative Extension to learn how to plan for the upcoming cool season garden, including what you can do to extend your season and how to save seeds from this year's favorites so you're ready to hit the ground running in the spring. There's a free virtual session on Saturday, August 27th from 10 a.m. to 12 p.m. There's a link for registration, and you can also contact Jess Epson at JEPSTEN@DCONC.gov. Logo contest for Library Fest 2023. The Durham County Library has a call for submissions open to all Durham County residents and students to design the 2023 Library Fest logo. Logo designs must reflect the theme of storytelling and include the words Library Fest 2023, the Storytelling Edition. Please submit designs by email to choltzman@dconc.gov or deposit designs at the Durham County Library front desk. The deadline date is September 16th, 2022, and additional information can be found at durhamcountylibrary.org. The 2022 annual property tax billing. The Durham County Tax Administration mailed 2022 Durham County property tax bills to Durham County property owners on August 3rd, 2022. Taxes are due on Thursday, September 1st, 2022, but must be paid by Thursday, January 5th, 2023 to avoid interest and additional fees. For more information, you can call the call center at 919-560-0300 or visit the website dconc.gov/tax. The Durham Low-Income Homeowners Relief Program, LIHR. The new and improved LIHR is accepting applications. LIHR will provide property tax help on current taxes for eligible homeowners. Tax assistance is based upon a 3-tiered income model and other improvements. Apply between August 1st and January 31st, 2023 at dconc.gov/DSS. You can also call 919-560-8000 for an appointment. And lastly, Solarize Durham program. Durham County encourages residents, landlords, businesses, and nonprofits to participate in the Solarize Durham program to save on the cost of installing solar energy systems and batteries. Solarize campaigns are driven by community group purchasing and offer a tiered bulk purchasing concept and a fully vetted installer. The more residents, landlords, and businesses who contract for solar installation through the program, the more savings occur for all participants. Yes Solar Systems is the exclusive solar installer for this program, and they're offering costs that are 25% lower than market costs. Durham County has allocated funding to subsidize solar energy systems for some low-income households. Anyone in Durham County who is interested in participating in Solarize Durham can sign up for a free, no-obligation solar assessment to see if installing a solar energy system on their home or office makes sense. You can visit www.solarizedurham.org before the December 31st cutoff date. That concludes the announcements in tonight's agenda.
Thank you, Ms. Wallace. I think, you're going to speak on this issue? Okay, go to the mic and introduce yourself.
Good evening, commissioners, manager, staff, and guests. My name is Tobin Freed, and I'm the Sustainability Manager for Durham County. And I'm very excited to give a little more information on the Solarize Durham program that was just announced in the announcements. As was read, this is a program designed to make it easier and more cost-effective for Durham residents, landlords, business owners, nonprofits to install solar energy systems on their facilities. And the goal is to increase the amount of solar energy that's being generated here, clean renewable energy, and that will help us, Durham County, meet our greenhouse gas emissions reduction goals. Something we're modeling here in Durham County with our renewable energy plan, for our own buildings, and we want to share that with the community. So this is a great way to do it. So we have partnered with the City of Durham and with 10 other local governments and the Triangle J Council of Government. So it's actually a triangle-wide program called Solarize the Triangle, and we have Solarize Durham. And so you'll be seeing a lot of this all around. The idea is really to bring costs down by the group purchasing. So the costs, we get economies of scale. When more people sign up, it costs less for the installer to purchase the materials, to install the materials. They're not doing the marketing, we're doing the marketing for them. So they are really able to give us a great price, not only on the solar panels, but also for battery storage. That's something that people are interested in. And as was mentioned, the county graciously allotted funding, and so did the city, specifically for low-income households to participate in this program. We know that even with costs that are 25% lower, that's still more than they could afford, but they should also be able to benefit from this. And once you have solar on your house, your energy bills will come down. So that's a great way to reduce the overall cost of living for low-income households. So we'll have more information on that soon. We will be partnering a lot with community organizations that are already working in the community with low-income households so that they can really connect us with them. I do want to mention again that Yes Solar Solutions is our exclusive provider for this. They were fully vetted. They're an excellent local woman-owned business out of Cary. We're very excited to be working with them. They worked on the previous Solarize campaign that was about 8 years ago, and come with a lot of experience, great customer service. This is going to be a good experience for everyone who participates in it. I also do want to mention that you probably, if you've been on social media or anything like that, you might have seen ads that talk about Durham County is providing this or that. That's not us, and so I do want to caution people that there are advertisements out there that are maybe not as honest as they seem to be. So I just want to make sure people know they should be looking for the Durham County logo or the City of Durham logo or the Solarize the Triangle logo. I'm too short to show it there, but it looks like that. And really make sure that you're going to the right place. And anyone who is interested, as was mentioned, can go to solarisedurham.org, and you can just put in really quickly your basic information, and someone will contact you to do the assessment. If you can't get online, you're welcome to call me at 919-560-7999. Oh, I should also mention that President Biden signed the IRA last week, the Inflation Reduction Act, and in that it increased solar tax credits to 30%, and so that will even help bring the cost down more. It's really good timing on that. Are there any questions? I appreciate the time tonight.
Just want to thank you for all the work that you and your team have been doing around this. We really appreciate it. And we wanted to give you an opportunity to just talk about that a little bit tonight. And, you know, the timing couldn't be more perfect, as you said, with the Inflation Reduction Act that our president signed off on. So thank you so much.
You're welcome. Everybody sign up. The more the merrier. So thank you.
Thank you.
Here, I did have one quick question. It was just, it's not necessarily for Tobin, it's for, it might even be for PR staff. I know that we sent out an email, not we, but I, along with some other folks, I know that the manager sent out Solarize Durham on her newsletter, and the county did, and that the deadline is December 31st. So I just want to uplift, you know, this is a great opportunity. I'm wondering, you know, between our office and PR, how are we going to push this out so that we will, you said the more the merrier. I want to, you know, however staff wants to do it, that we're consistently asking for applicants.
Yeah, thank you. And we will be working on that. I've already been in discussions with our PIO about it. I'm going to be speaking at the Inter-Neighborhood Council tomorrow, and excuse me, we're going to post it on Nextdoor, really as going to the PAC meetings with the city, really trying as best we can to get the word out to everyone. Thank you for bringing that up. And also, as you mentioned, the deadline to sign up is December 31st. This is a 2-year program, so if people are not quite ready yet, we will be offering it again next summer. It's not going to be forever, but think about that. Yes.
Commissioner Jacobs.
Thank you, Tobin, and thank you for leading us through this. Is really exciting. I may have missed this. Do we have an estimate of how many people that we're going to be able to serve with the county funding, or how many people could, you know, best case scenario that we could get, at least in this first round, be able to help?
Sure. So we have about $50,000 from the county and about $50,000 from the city. And the estimates from past Solarize programs, there was one up in Asheville, Buncombe, and a couple other, is about $10,000 per system. So we'll be doing more or less about 5 with the county funding and 5 with the city funding. There are opportunities for fundraising with this, and so it's possible that we will get more money, and certainly with a lot of the federal funding that's coming down, some of that might be able to be used for this, depending on the timing and what it can be used for. But that's how far that will stretch.
So in other words, if we find more funding, can we serve more people?
Absolutely.
So if you could keep us posted on the applications, and if we find that there is a lot of interest, please let us know,
Okay.
because we would like to be able to serve more people if we can.
Thank you.
Thank you, Tobin. So, Commissioner Alum is not here, as everyone knows, and just for the public to know that she's not here because she's given birth. And she will be out for a little bit. She's got a little girl. Okay. Commissioners, wanted to acknowledge one that's been working in our community for quite some time, and she's leaving us. So I want her to have an opportunity to come and just talk about what it's been like for her to do the work that she's done, and that she's moving on to another adventure. So Tika, if you would come and share however you would like to share.
Evening, everyone. I hope you're doing well.
Great.
Thank you, Commissioner, for just calling me out on the moment. It wasn't an easy decision to make. 20 years ago, this idea of system of care was brought to the state, and Durham was one who really decided to invest in what does that look like for our community, not only for our children, youth, and families, but also for every agency and child and adult serving system. And it was about bringing people together. Many people in North Carolina have tried to create the model. However, Durham County Commissioners made the decision, along with the educational system, and Heidi was part of that years ago. Let's do it. That would be the way that we will do business. If you want to do business in Durham, we will collaborate together, and we will support our children, youth, and families. Not only with mental health, it included every system, from the judicial system, the educational system, the public health system, as well as, of course, mental health. The outcomes were so phenomenal that people across the state began to come to Durham. And one of the components was to have what is called a system of care coordinator and a family partner. And my role was the family partner. And it was to change the trajectory of how families were perceived and to ensure that families realized that they had a voice. But to me, it meant much more. How do we go from protesting, showing pictures during that time that was happening in our community? How do we get families' voices to be heard, to change, possibly change some policies and procedures? That means we got to believe in the process and invest. And the county commissioners, you trusted me to lead that to lead that charge to change the trajectory of how people perceive families. And I'm grateful for that. We now have school-based mental health because of your trust in schools. We have people such as Grudem really open to looking at, let's hear as we make plans for our children and families and our youth. And that was the amazing thing. As people began to come to North Carolina to say how it can be done and trust the process. Not saying that all families were 100%, you know, in the right, but at least they had their voice heard. They began to understand how systems work. And we created the Child and Family Team process. With all of that being said, my goal was to support Alliance in the tailored plan, creating the family component. However, when God has a plan for you, it may not be the one that you have. And opportunity presented itself. The state afforded the University of North Carolina, Greensboro, dollars to create a component to amplify the voices of youth and families. And I've accepted the role as their program manager after being my county, I love my Durham, lead family partner coordinator. So again, after 20 years, it wasn't an easy decision. Got a lot of mixed feelings, you know, about doing it, but I know we have solid relationships here. I plan on taking the model that we have created and hopefully spreading it across the state, because it's a statewide initiative. And I say initiative, I don't know, God just seems to put in my career new initiatives, you know. So I hope that each of you feel that I have represented our county well, which they did not think that this system of care could go anywhere. Well, we took it to a national level. We took it to the state level. So I think you should be very proud of that. That could not have happened without your leadership, and that is so critical for you to understand. And I appreciate the challenge that brought. So to each of you here, many of you in this room, I have partnered with your staff. County commissioners, thank you so much for your trust and belief in me that we can make something great happen. Thank you.
Thank you so much. We'll give the commissioners an opportunity if they have something they'd like to say. Mr. Jacobs?
Well, Tika, I'm so grateful for you. And, you know, you have laid the foundation. I mean, family and child teams, they're just a part of what we do now. And that I just am so grateful for you and everything you've done. And you've been such a champion and an advocate, but we are really going to miss you, because there's no one that can replace you and your spirit. So we will have to let you go and share you with Greensboro and the rest of the state, because you have important work to do. So thank you, and I really wish you the very best.
Commissioner Carter?
I also want to send Tika off with our loving admiration and thanks. The child and family support teams that you talked to us about, Tika, that Wendy just mentioned. I remember, you must have been here for about 2 years, Tika, because I was on the school board in 2004, and everyone was talking about child and family support teams. People would come to us and say, what are you going to do about the suspension rate in Durham Public Schools and its disproportionality across race, et cetera, et cetera? What are you going to do about the achievement gap? That was one of our number one strategies, was taking a systems approach and working through you and all of your allies to develop these teams that would wrap services around children and help them succeed. You believed in them and their families, and you helped them succeed. And you're going to be great for the state now. Lucky them. Our loss is their gain. Thanks for being here tonight, and thanks for everything you've done for Durham.
So Tika sent us that little goodbye email, and she thought she was going to get away with not having us acknowledge her. No way. So, Tika, I've been here through this process, and it's so great to see how you flourished, how you really made parenting and parents and family important in the work that we do. So I just say thank you again so much and wish you the very, very best. And, you know, I always think when you say you go into Greensboro, and my kids live there, see what's happening with them, that they can participate with you. But thanks again, and we wish you Godspeed. All right. Couple of things before I get to the ceremonial items, Commissioners. There are a couple of acknowledgements I want to do here. You know, we have been to quite a few, we've been to our national conference for commissioners, and we've been to our state conference. The National Association of Counties has been really great at appointing. Durham County ends up participating in a lot of national initiatives. So there are two I want to lift up here. One is on the appointments for Commissioner Burns at the NACO committee and on NACO committees. The National Association of Counties incoming president Denise Winfrey appointed Durham County Commissioner Namashina Burns to two key committees recently during the organization's annual conference as county leaders gathered in Adams County, Colorado. Commissioner Burns was selected to serve as vice chair of the Justice and Public Safety Steering Committee, subcommittee, and as vice chair of the Resilient Counties Advisory Board. Those are two that we lift up. And the president's theme will highlight service, the important work of committees in the following realms: resiliency efforts, promoting inclusion, establishing sovereignty through economic mobility opportunities, and empowering county leaders and residents to rise by providing educational resources and tools for informed decision-making. So those are two of the committees that Commissioner Burns were appointed to. Just want to lift those up. And then Commissioner Jacobs was elected to the NACO Familiar Faces Initiative Leadership Network. And this is a new initiative that NACO is undertaking. And if Commissioner Jacobs, if you want to talk about that a little bit, and also Commissioner Burns, if you'd like to lift up anything about yours as well.
Thank you, Madam Chair. I'm really excited to be a part of the Familiar Faces Initiative Leadership Network, one of 13 elected officials from across the country and the only elected official from the South, so I'm feeling a lot of responsibility. And I really want to also acknowledge our interim general manager, Gudrun Palmer, and our director of our Criminal Justice Resource Center, who's really behind the scenes working with me, as well as Helen Tripp, who is our director of our community paramedicine program. And this initiative is looking at people who are often call 911 for help because they are marginalized people in our community who do not have access to physical and mental health care. So often people who are justice involved, who are overdosing on substances, people who are experiencing homelessness. And so this network initiative is looking at data-driven solutions, and I look forward to ways that we can improve what we're doing here in Durham, but also across the state, because this is a state, local issue, a national issue, and a state issue. So I'm really excited and grateful for the opportunity. Thank you.
I will be quick. I really am excited about this opportunity. We had an opportunity to submit our applications for leadership early on, and I was hopeful that I could put together a packet of what I've done here and what I've done in my own public service life. And to see that somebody found value in it means a lot. I hope to make Durham proud. Anybody who doesn't know about the Resiliency Advisory Board, they actually look for ways to mitigate risk and actually help build up infrastructure in towns. And that's something that I've done with my public life. I mean, done outside of this political space for a number of years. And to know that I think sometimes we take for granted that, you know, Durham is a small place in comparison to a lot of other communities. Durham is really, really big. I think some of the ideas we have about affordable housing, or what we have about emergency rental assistance, or rebuilding houses that were hit by hurricanes, or how we deal with fires that happen in the mountains. North Carolina is just very unique in that we deal with all of these issues annually. Annually. And so we're in a special position to be able to go out and talk about best practices with counties that are a lot smaller than ours, that are the same size as ours. I count it a privilege to sit on JCPC here and to be able to uplift some of the things that we've done in Durham, some things that even I've pushed back on, but we've been able to do some really great work, and that includes some of the work with the Safety and Wellness Task Force. And you see in other communities, you know, they just don't have some of those ideas. And then there's some really great ones that they've brought back to us about how we can handle things in juvenile court. So I do look forward to uplifting a lot of the stuff that our staff has done, but not just what you've done, but uplift the staff, because a lot of these ideas come from both you and some of the city employees. And I'm excited to let the world see what Durham can do, and let the world start implementing what Durham does. So thank you.
Our next conference, we're going to make sure that Commissioner Carter goes with us as well.
I'm so grateful to my colleagues for their willingness to step up and do the extra duty. And I say that with all sincerity. I know it's extra work, and I admire you for your fortitude around it all.
Okay.
And even though we've celebrated it, we do have to remind everybody, I know Wendy and I are on some boards, but the big board is the actual NACO board, and the person who does sit on it is Chair Howerton. So that's the big board.
Thank you, Commissioner Burns. Our next item is a ceremonial item, a resolution supporting reproductive justice and freedom. And this is an item that this entire board is so committed to. There's been a lot happening since Commissioner Carter started to write this resolution. The Supreme Court's decision to overturn Roe v. Wade will have a disproportionate impact on those who are struggling economically and more likely to experience structural challenges to fully experience their liberation. The ability to choose when to start or add to one's family is of utmost importance. So the board has previously prioritized Black maternal health as a public health crisis and recognized the intersection of abortion rights. These emergencies both stem from historical and ongoing racism and are tied to a legacy of reproductive control and cohesion. In the United States, maternal health outcomes are worsening at an alarming rate, with Black parents bearing the brunt of this crisis. The desperate impact of mortality, morbidity, and mistreatment in maternal care settings on Black parents is linked to the systemic barriers they face when assessing abortion care. So there is, and then recently there was an article in the paper talking about the doctors gathering online to discuss the ramifications of the U.S. Supreme Court decision. So there's been a lot, and where from day one this board has stood in support of women and reproductive rights. So we have a resolution tonight that we are all going to share in reading. If I can, what did I do with it here? So this is what I will do. I'm going to start with Commissioner Carter. 1, 2, 3. You'll read the first, where 3 and the fourth one. 4 whereases. And then we'll switch over to Commissioner Burns, and you will read 1, 2, 3. The next 3. And then Commissioner Jacobs, if you will read 1, 2, 3, 4. The next 4. And then I'll end it. Does that work for you? Okay, Commissioner Carter, if you will begin.
Durham County Board of County Commissioners resolution in support of reproductive justice and freedom. Whereas the Supreme Court's decision to overturn Roe v. Wade, a legal precedent which upheld the constitutional right to privacy and freedom of choice regarding abortion, sets the clock back approximately 50 years and jeopardizes the health and lives of countless Americans. And whereas the right to safe and legal abortion is a fundamental human right and must be protected for all, especially in the aftermath of the Supreme Court's dangerous decision. And whereas the current ruling will have a chilling effect on reproductive health care providers and their patients, and it will create a new and limiting landscape in how reproductive health care providers are trained. And whereas ending a pregnancy should not be criminalized by government. And
whereas safe, legal, accessible, and affordable abortion care is essential for safeguarding health, reducing mortality and morbidity, enabling healthy spacing of pregnancy, and promoting health equity. And whereas eliminating constitutional rights to make decisions about one's own body will adversely impact people of color and members of the LGBTQ plus community who encounter racism from healthcare providers at higher risk, disproportionately experience discrimination and access limitations to healthcare services and resources, face unequal pay, and are more likely than their white counterparts to lack health insurance. And whereas banning access to health care particularly exacerbates the risk of negative reproductive and maternal health outcomes with lasting health and economic consequences for individuals and society as a whole. And
whereas existing health inequities will hold true with access to reproductive care, those populations that face systemic oppression and barriers with limited access to health care will be up against heightened challenges in seeking abortion care, affordable contraceptives, comprehensive reproductive health information and education, gender-affirming care, and freedom from sexual violence. And whereas the Supreme Court ruling will make access to some abortions impossible or extremely difficult, depending on where in the U.S. one lives, number of weeks gestation, medical conditions, and other factors. And whereas a United States District Court judge in North Carolina recently allowed a law that bans abortions after 20 weeks of pregnancy to be reinstated, and whereas reproductive health restrictions can have long-lasting negative mental, physical health, and financial impacts on people's lives. And
whereas our historic women-led Durham County Board of Commissioners is committed to the protection of all women, trans and gender non-conforming people's access to reproductive health care and safe abortion. And whereas President Biden has issued an executive order to protect access to abortion and reproductive health services, including access to federally approved medication abortion. Now therefore be it resolved that the Durham County Board of Commissioners do hereby reaffirm our commitment to a broad and ambitious vision to protect and transform all the structural conditions required to ensure reproductive justice. And be it further resolved that the Durham County Board of Commissioners commit to support and enhance the Durham County Department of Public Health's provision of client-centered family planning, sexual health, and reproductive health services. And be it finally resolved that the Durham County staff will explore ways to protect access to abortion and reproductive health services and identify all actions we can take to increase points of access for reproductive health care in the county and remove barriers to this care. This, the 22nd day of August 2022. Thank you, Commissioners. Are there any other comments? Commissioner Jacobs.
I just wanted to thank my fellow board members for our unity on this really strong resolution. And I especially want to recognize Commissioner Carter for your leadership on this, and General Manager Joanne Pierce as well for really helping us strengthen the resolution as well. This is a true collaborative process, and I'm just grateful to everyone. And I really want to lift up that we're talking about people's access to health care. Fundamental health care is what this is all about. And also, just to lift up what happened last week in our state, which is reinstating a 50-year-old ban. So we not only have gone back 50 years with Roe, but here in our state with reinstating the ban on abortions after 20 weeks. And we've heard many doctors say that, at this point in time, it's usually because there's some medical emergency or because someone has not had access to care. And I know a lot of our health professionals are very worried, and politicians, none of us, including us, should be making decisions about what is a medical emergency or not, what is a life-threatening decision or not. That is up to between a person, a woman, and their doctor, and nobody else. So one thing I was going to ask is, and to hear from our board members about who we should share this resolution with. Deborah, your recommendations, obviously the Public Health Board, but I think this is an important resolution that we should also share with stakeholders for them to know. I was thinking about Lincoln Community Health Center Board, Duke and Durham Regional Hospital, but any other suggestions from our board members about who else should receive this resolution?
So we could always, Deborah could compile a list of, yeah, who's already on it, compiling a list to send it to. Okay, thanks, Deborah. You know, there was something very special about putting this together when we first received the first rendition of it. And I said to Commissioner Carter that, you know, there needed to be a little bit of smoothing out, or she could go with it, and the ones that supported the entire thing would go with it. And she said, no, we're going to work it until we have everybody on board. And that's what this board is doing. That's what we are doing as a all-women-led board, because one of the things that we are consistently asked when we go to conferences, y'all got a 5-women board? How y'all doing that? I said, we're just doing that. We're just doing that, you know? We're just getting the work done. So, now we're down to the consent agenda. We have many items here.
Yeah, Howard.
We have a consent agenda, and we
Howard,
have
my
one
comment was
person,
quick.
excuse me, I'm sorry.
My comment was quick. You remember? I was next.
I'm sorry, you have,
Yeah, it's fine. I know you was on the road. I was after Wendy though. They were tapping.
okay.
It's quick.
Commissioner Burns, please forgive me,
No, I do, because it's emotional for all of us. I don't know if y'all remember the week that it happened. I think Commissioner Carter and I didn't say anything. Commissioner Lum and Brenda, Chair Howerton took the brunt of it because I think we were just shell shocked. But I actually wrote mine down, and it is not going to take more than like 90 seconds. I know y'all are proud of me because I would have gone off on a tangent. So I promise you, it's really, really quick. I think that there's thank you, Commissioner Carter, and also, even though Commissioner Alam is not here, she did do a lot of background work, so I ditto everything that Commissioner Jacobs and Chair Howard said about Joanne and Rod and everybody, and even the manager pulling together the data and the facts for us. So I'm very thankful. This was collaborative, and it's not the end. It's kind of the beginning. So here we go. On June 24th, 2022, the United States Supreme Court, in a landmark decision, held that the Constitution of the United States does not confer a right to a woman to have a choice over to women to have a choice over their own bodies. The decision overruled Roe v. Wade, 1973, and Planned Parenthood versus Casey, 1992. In one sweeping move, my generation is now the first generation to have less rights than their mothers. Some might question how is it even possible that in 2022, that between Juneteenth, our Juneteenth, and July 4th, Independence Day, one branch diluted the definition of independence for the majority of those residing in this country. If this were an argument about saving the lives of children, then we would see legislation passing for universal health care, paid family leave, paid medical leave, expansion of Medicaid, and universal child care. All of these things could improve birth rates and reduce infant mortality, and maternal morbidity. If this were true about saving lives, then the nation would do as this Durham Board of Commissioners of all women has done this past budget cycle, and invest in maternal health by adding maternal health nurse lactation specialist, a maternal health nurse, and operating funds to support the nursing positions. They would mirror our example and invest in culturally competent nonprofits that work daily to reduce the staggering racial disparities found in infant morbidity rates, and invest in school nurses. They could do as we have done and improve the pay and salaries of those not making a living wage. We must dismiss the narrative that this is about saving lives. It is and always has been about control. Most troubling, decisions like these will continue to be forthcoming unless we choose to act like this board is acting. Eliminating our constitutional rights and disregarding nearly 50 years of precedents is only the beginning. Will you sit idly by when they roll back voting rights in an effort to suppress our votes? Will you sit idly by as our pleas for gun control are ignored? Will you sit idly by as they refuse to forgive a significant portion, if not all, in my generation's case, of student loan debt? What will you do when they come after a right that you take for granted? As my board members have said, healthcare decisions are personal and should not be made by politicians. I hope you can join us and support this all-women board in this resolution and continue to protect the rights of all Americans. That's it. Residents.
Okay, so we're moving on to the consent agenda. Commissioners, we have one citizen signed up to speak, on 220461, 0464, 0489. We'll give you, few minutes. Ms. Wall, Ms. Antoinette Haynes, if you will identify yourself at the podium, and let me see if these things, all of these items need to be pulled, or can you tell us what it is that you want to discuss with us regarding these items?
Hello, my name is Antoinette Haas. I'm at 5610 Catskill Court in Durham. And I am speaking on agenda item 220461. I think that's a very impressive number, that 250,000. That's awesome, considering the situation that we have with our educational system. As long as I've known of, been cognitive of North Carolina's ranking, we've always been in the last 45, 46. We go back and forth. But I think this is awesome. What my concern for this item is that the workforce development program, that it's evolving with the need of the workforce. Keep in mind that it's changing. No longer data entry. They want you to be specialized. No more of a secretary and case management. Those things are going to evolve. And so my concern is that the training for the workforce development program evolves with the workforce, such as data mapping, data conversion, cybersecurity is a big deal. And so what I'm hoping is whoever is in running this and regulating this program, not sign people up to remain in low income, that these programs allow people to elevate and escalate to a more prominent, productive lifestyle.
Thank you. So there are two other items that Ms. Hayes pulled. Before I address those, I'm going to ask for a motion to approve all the other consent items except 0464 and 0489. So if I can get a motion to, unless, was it anything commissioners need to pull?
I just wanted to lift up, not that, I would love to hear a little bit more about it, not that we want to delay it, but about the two items about kids voting, because that's something new with these partnerships. And the other thing was, I did want to understand the last item,
Okay.
the 0491, just, I did have a few questions about that process with taxes that we're no longer collecting on. And related to the item that was just talked about, I would love to hear a little bit from I know Casey Steinbacher's here, just to lift up that program and about where we're at with recruiting people and
So
just for the
Commissioner Jacobs,
community to
do you
hear
want
more
to
about
pull
that.
those two items so that we can go ahead and
Sure.
approve the others? Okay, so why don't we just pull those? Was it 487? And what was the other one you wanted to have someone talk on? Was
Well, I hate to keep people.
485?
Yeah. If we could maybe just pull, I don't want to keep Casey and those folks here.
It won't take but a few minutes. We just
Okay.
need to move the other items and then have them
Okay.
speak on those for a few minutes. All right, so I'm going to pull those two items. And Ms. Haynes, if you want to speak on both of the two items that you want to speak on, I can give you 2 minutes to speak on both of those before we go ahead and approve those.
All right, so agenda item 22, I'm sorry, did I do that? Okay, I'm sorry. Item 220464, which is the fiscal year for 2022-2023 Greater Durham Black Chamber of Commerce. That number I am not impressed with, that $50,000 for small businesses, especially for small Black businesses. I don't know if anyone knows anyone who runs a small business, but they work sun up to sundown. And that number for a business, especially after COVID, if it is possible to increase that number, that would be apropos to the better interest of the Black Chamber of Commerce in Durham. It is too small. I think that number needs to be reevaluated. Did you want me to go to the next item?
Please.
Okay, so the next item is 220489, Budget Ordinance Amendment for Funds Balancing Engineering Department for covering miscellaneous legal and due diligence costs. Is ridiculous. $150,000. I'm trying to figure out what you're trying to figure out. I mean, if this property is being mapped and courted for purchase, what is the purpose of all of this extravagant legal fees? I think that's a lot. I think that if Durham is preparing to build and to elevate a property and improve it, $150,000 is way too much outside of the actual cost of developing the property. I just think that's way crazy. But if you want to switch that $150,000 with the $50,000 you got going to the Black Chamber of Commerce, now that would be more to my liking. I'm just a taxpayer. I don't know anything. I'm just saying.
Okay, all right. All right. So Commissioners, can I get a motion to approve all the consent items except for 489, 487, and 485?
So moved.
So we have a motion and a second to approve the consent agenda except for 487 and 485. Roll call by the clerk.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. It's passes unanimously. So if we can go back to the two items, because now we would be down to normally what we do, trying to move this along. So Commissioner Jacobs, you just wanted them to share a little bit more about those two items. Why don't we do that before we go to the presentation for the public health? We can have her talk about the 4-H. Let's see. This is 487 that you're going to be speaking on.
And 485.
Yeah, 487, corporate extension. So if you want to speak on that one for a few minutes.
Good evening, Commissioners. I'm Donna Rewalt. I'm the County Cooperative Extension Director. I'm here with Carolyn Kruger, who is the Program Coordinator for Kids Voting. I'll let her talk mostly about these items, but I wanted to say that both of these items are in tribute not only to the support that you all have given the Kids Voting Civic Education Program in Durham County, but also to the work of Carolyn Kruger and all the many volunteers and youth who have worked on this program for many, many years. So it's been recognized across the state multiple times, and at this point really is the flagship program for the state and model for how to do youth-involved civic education. And so one thing that has happened over time is that our cooperative extension partners have recognized the value of that. 4-H, one of the H's, does involve a civic education, and we have a great approach in Durham, and they would love for us to work with them on expanding that, which also benefits our local program. We also have this wonderful Orange County partnership, and I want Carolyn just to share a little bit about how these partnerships really actually enhance the work that we do in Durham County.
Good evening. So first I want to echo what Donna said. Kids Voting Durham is really the flagship Kids Voting.
Would you tell us your name and?
Oh, I'm sorry. I'm Carolyn Kruger, and I'm the program coordinator for Kids Voting Durham at Durham County Cooperative Extension. And so I wanted to underline what Donna said, that Kids Voting Durham has really become sort of the gold standard, not only in our state, but really in our country, because of the support that Durham County has given it, the space that it's given to thrive and flourish and grow over these last 16 years that it's been here. And as a result, now that our communities all around us are becoming so much more aware of the urgency of building the civic skills, the civic knowledge, and the civic agency of our young people for the benefit of our communities in the long term, people are turning here to look at what we've done and to have us help them in their community. And that's a wonderful thing, because these statewide partnerships that we're now forging also benefit us here in Durham County in a number of ways. First of all, we just give our youth more exposure and more interaction with people with different life circumstances and different lived experiences than they have. And that's to the benefit of their civic development. But secondly, it's going to give us the resources to even pursue more in-depth some of the things that we've done well and can do even better now. Creating curriculum and educational resources for our schools, for our after-school programs, and also building the volunteer capacity of people with the civic skills to then take them to others. An intergenerational civic core of people that can really bring some of these programs and skills even more broadly in our community, where we have so much unmet demand right now. So thank you for giving us the base that allowed us to grow into these kind of regional partnerships, and for providing the leadership in North Carolina in such an important field as the engagement of our youth.
Well, thank you so much, and thank you for the work that you do and with our young people. So all of us have been to kids voting. You know, we can't get elected without going through kids voting. So it's wonderful, the work that you do with them, and we are seeing that at the state level. So thank you. And even this past our state conference, the 4-Hers, there were kids from all around the state there at the conference, because they do a special program for our youth. So, Commissioner Carter?
Really quickly, I just want to say the kids voting program is amazing, but I think that Carolyn Kruger is the reason it exists.
Yeah.
Carolyn, you're amazing. You've always been tenacious about this cause. Your passion shows here tonight with everything that you do. You really are making a difference, across the state now. And I hope you feel as proud of yourself as we are of you. Thank you for all your work. Like Brenda said, you do run one of the most difficult forums for candidates, and your questionnaires are hard, but just everything. It's amazing. The voting that happens in our school system with my own children back in the day, they voted. I mean, you've been at this a long time. Thank you.
Thank you.
Okay. So you were speaking on 487 and 485, right? Okay. Thank you so much. Is any other questions or comments from any other commissioner?
No, thank you so much. And the questions that I had for Dwayne, do you want to wait on that for the last item? I had questions about that last item.
So we voted on all the items except for these two. So if you want to go back to one that we've already voted on, we need to go ahead and approve these two. Okay, so can I get a motion to approve these?
I would make a motion to approve item 22-0485 and 22-0487.
Okay, it's been moved and properly second. If we can get a roll call, please.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. Approved 4-0. And, okay, and we want to move, you want to have Steinbacher speak on which one?
It was just the last item about settlement of property taxes. I just had a question because one of the items was 10-year schedule. I guess we've been trying to collect those for 10 years. If you could just explain how that process works, and that would be helpful. Thank you.
Sure. Dwayne Brinson, Durham County Tax Administrator. This is the annual settlement that you'll see every year about this time with the board. What ultimately controls is a financial audit, but the settlement, one of the most important things with the settlement is that the board charges me with collecting the upcoming year taxes. That's one of the most important features of the settlement action, statutory. But there is a statute of limitations on property taxes, and we have here in the abstract summary, it's 10 years. Fortunately, there aren't too many of those that we haven't collected in 10 years, but the statute of limitations in North Carolina law says that if a tax is more than 10 years past due from the due date of the tax, meaning September 1st is when taxes become due, then we can't enforce collections any longer. Now, if somebody walks in and says, I've got a 12-year-old tax bill that I want to pay, we can take the money. We just can't in no way enforce that. We can't send a bill, certainly can't garnish. So it's just a way of relieving the duty to enforce collection of that tax. Does that answer the question, Commissioner? Yeah.
Very helpful. It was interesting, though. I did notice a few on there who were still functioning businesses, which was interesting. But, I understand there is a burden on us to keep having to do that. And if that's the state law, then that's the state law. So it's helpful to hear that. Thank you.
You're welcome.
Okay, thank you, Dwayne. All right, if there are no other questions, we will move on to our update on our Durham County Public Health Focus Update. Jenkins is here to give us an update here.
Good evening, Madam Chair, Madam Vice Chair, other commissioners, general managers, Interim Attorney Darby. Rod Jenkins, Public Health Director. Delighted to be with you once again. So I'll go right into it. Our COVID statistics for your edification is currently sit at 702 total cases in the past 7 days. Since I last appeared before you, we've had 4 deaths due to COVID. So, as I've always said, COVID continues to be a clear and present danger in our community. 7-day moving average was 100 cases. This is, in fact, a decrease of 29.58%. And since the pandemic began, there are 90,398 total cases as of yesterday. We continue to keep a close eye on race and ethnicity trends, and at present, our Hispanic population in Durham is overrepresented, not by much. I don't believe it's anything to really fret over, but we are continuing to keep the communications going with our Latinx population and let them know how serious COVID continues to be. our Black African American population proportionally represented, and our white population continues to be underrepresented. Our positive lab or positivity percentage continues to be at hovering around 19%. I remember way back when, if we saw 19%, we would lose our minds. But as it stands right now, that is the average. And as I continue with the slideshow, you will understand why I'm saying, again, we clearly understand, we know what to do, we are well versed on COVID-19, and we are successfully living with COVID-19 at present. Hospitalizations remain steady with ICU beds remaining stable. We continue to keep a close eye on this. In other words, we're not in dire straits that we were in January, and for the most part, it simply means that folks can get a bed if they need it. But it's important that I let this board know that the majority of the hospitalizations still are in individuals who are not vaccinated. And that is the word that I'm getting from officials at Duke. We always want to give you the ground truth as to why we're high, and that's primarily because we have a lot of cases. We do have a number of percentage of COVID-19 over 7 days remains pretty high, and this next slide will show you that we're not alone. So if you will look at the state of North Carolina, clearly approximately 85% of North Carolina is high. And again, that is attributed to the BA.5 variant, which I will explain in a few seconds, but it's highly transmissible. And, again, it's still here. So we need to ensure that we take the proper precautions. This slide right here continues to be a very busy slide, but I always present it to my board because I want you all to understand that we keep a close eye on the variants. And at present, the BA.5 variant is the dominant variant, making up over 88.9% of our infections in our region. And to put things into perspective, the last time I spoke to you, the BA.5 was coming on strong, and it represented 53.6%. So within a month's time, it has truly taken over. So we always want you all to know exactly what's going on with the variants. And for the most part, it is, although highly transmissible, it's nothing compared to what we experienced with the Delta variant and some other original variants that really were taking people out. So we continue to express the need for caution, but again, it's important to know exactly where we stand. Vaccine updates, again, ever so grateful to Monica and Maceo for always letting folks know the best way to go get their vaccines. We are seeing sort of a dissipation of our pediatric population. Most have been vaccinated. We were delighted to vaccinate those individuals, but we are now inside the booster season. So we have placed our pre-order for the autumn COVID-19 booster. Now, per Dr. Jha, who is the White House coronavirus response coordinator, autumn boosters will be available to anyone over the age of 12. So, of course, we're encouraging the listening audience to prepare themselves. This is the only information that I have at present. We're still waiting on the North Carolina Department of Health and Human Services to give us further instructions. However, please know that Durham continues to be on the ready, and we have already pre-ordered 1,500 doses of the Moderna and the Pfizer autumn booster. So get ready, Board of County Commissioners. I expect to see you at 414 East Main Street. COVID-19 testing continues to be held at Lakewood Shopping Center, close to El Centro Hispano, every day from 10 to 6. We did have to really continue to ramp up our efforts and let people know that it's there. But just please keep in mind that there's still 30 locations within the Durham community where our residents can go and get their COVID-19 test. We also, I'd be remiss if I didn't say that we are also at the corner of our building. in a nice little sliding window, we are giving at-home tests, and we're averaging about 200 at-home tests that we are distributing per day, per business day, I should say. So we have a very robust supply of at-home antigen tests, and we encourage the listening audience to come and get it if they need it. You should always know exactly what your status is, so we have that available for you. Final thoughts before I touch on monkeypox. COVID-19 is still here, it's not over. So we need to continue to stay prepared. We have the tools to do it. And we know that we're going to continue to experience waves of COVID-19. Fall is coming, winter is coming, so it's time for us to prepare and just make sure that we're ready. Vaccines continue to be available, and it's there, it's here. So again, the vaccine continues to protect people from severe illness, hospitalizations, and even death. And it have three things, but I added a fourth, which is, again, stay up to date with your COVID vaccines, test and stay home if you're feeling sick. Get treatment right away if you test positive. And that fourth one, prepare to get your autumn booster when available. Of concern, as of lately, from a public health perspective, is monkeypox. Just a little background for you all before I entertain your questions, commissioners. Monkeypox is a part of the orthopox family related to smallpox. It has now been identified in Durham County, and as of today, we have 19 cases. 100% are male. 78.58% are of the Black or African American community. And it's a touch point that I'd like to take a point of personal privilege to really expound upon. Black African Americans are testing positive for monkeypox. However, coming into our agency to get the vaccine are not African Americans or Blacks. And I am just really perplexed. It's a free vaccine. It's available. Durham continues to be a leader. Vaccine distribution. We are distributing vaccines to contiguous counties. We're giving vaccine as far as Harnett and Guilford counties. So we have mastered the hub apparatus as far as distributing vaccines. We have done a number of different things to get the word out. Last Thursday, we had a town hall with myself, medical director Dr. Jeffrey Jinks, and a pediatric infectious disease doctor from Duke, Dr. Michael Smith. And it was well attended, but the main thing we wanted to do is let parents know that monkeypox is not a clear and present danger to them. And we also wanted to really get the word out to the African American or Black community that this vaccine is available. There's nothing to be afraid of. We practice discretion. We want you all to get vaccinated. So again, vaccinations, again, we have an ample reserve of Jenios vaccine. Durham Public Health is moving to intradermal vaccination in order to really spread out our current supply. We are in line to receive more. As I was sitting here waiting on my turn, I did get an email from the state asking our current status, and the first thing I said was, we need more. Please get us more. Eligibility, please know that this is not a Durham Public Health eligibility criteria. This is the CDC and the North Carolina Department of Health and Human Services eligibility, but anyone who has had close contact in the past 2 weeks with someone who has been diagnosed with monkeypox, or gay or bisexual men or transgender individuals who report any of the following within the last 90 days, having multiple partners or anonymous sex, being diagnosed with a sexually transmitted infection, or receiving medication to prevent HIV infection, better known as PrEP. Those are the criteria that will allow you to get your vaccinations. It's also important, I say to my commissioners in the listening audience, there are many individuals who want the monkeypox vaccine, but it is in limited supply. So we have to follow this eligibility criteria in order to be able to get you the vaccine. That is all I have for the moment. Happy to answer your questions.
Thank you so much, Ron. Commissioners, Commissioner Jacobs.
Thank you, Rod. Good to see you again.
Always a pleasure.
I have a few questions. One around the rollout for, school opening back up and just hearing a little bit more about how, where are vaccines being given out through Durham Public Schools or through school-based clinics, just wondering about that. And then related to monkeypox, wondering if we are going to partner for the Pride event on September 24th. And has there been any planning around, could we, actually be giving out vaccines there on site? And I guess the third thing is, it's my understanding that it's 2 vaccines, that you get one and then you have to come back a month later, and just wanted to get clarification on that as well. Thank you. And I guess also just same thing with COVID, that we found the most success with community-based partners. Hearing your dismay with that we're not reaching the folks that we need to reach, and just wonder how we could try to, some of the on-the-ground partners, see if they can help us. So those are some of my questions. Thank you.
Thank you, Madam Chair. And it was important for us to really get in front of the notion that monkeypox, monkeypox in school-age children, because when we had, most recently, we had a kickoff for school health nurses for them to celebrate and get ready for the school year. And as soon as I walked in the door, that's the first question that was asked. We've done our best to educate our school health nurses about monkeypox, because we know that they do get themselves inside precarious situations when they are the only ones at a school. And we want them to understand that every rash is not monkeypox. So with that being said, we have been working closely with Dr. Mabinga and Dr. Hardy and the administrative staff of DPS. We still meet with them bi-weekly, Madam Chair, just to make sure, Madam Vice Chair, just to make sure that they understand what's going on with COVID, what's going on with monkeypox. And last Thursday's town hall was impactful, because we had a resident expert on pediatric infectious disease who clearly proclaimed that monkeypox is, not necessarily a non-concern, but should not be a concern of parents when it comes to their kids going back to school. So we are prepared for, what may, if you will. One of the questions that we had was, should a child, be properly diagnosed? Can they get the vaccine? The answer is yes. So we are prepared for that scenario, but as my statistics show, it's been 100% males, adult males, and overwhelmingly African American. Did I answer all your questions?
That was great. Just wondering about,
Yeah,
are we going to
Sorry,
partner?
Pride Day. I'm sorry. How could I forget that? In addition to the town hall that we had last Thursday, Madam Vice Chair and other commissioners, we also had a successful event in partnership with the LGBTQ Center, in which we already had people scheduled for appointments. And we look forward to continuing that relationship with them, because they are our partners. But we are certainly prepared to stand tall alongside with them at Pride Day. We hope you guys are getting your steps in, because you're going to be walking in the parade, if that memory serves me correctly. But we are prepared to have our tent and be able to participate. Absolutely.
Great. Commissioner Burns?
Sorry. My question is relatively quick, but I do want to echo. I heard that the event went really great this weekend. Thank you for reminding me about getting in my steps after almost falling off the floor at Christmas. I think I will prefer to walk from now on wherever we go. I wanted to know, do you have, you gave us demographic data on race and gender. I'm curious to know if you have it on age. And the reason why I'm asking, I think, a lot with young people, they tend to be invincible in their heads. when COVID first hit, I'm young, I'll be fine, I don't need the vaccine. And just in talking to some of these young men this week with that group, and then I know some subsequent conversations afterwards, and where I'm going with this, and Rod, I might need your help on this. Joanne, I might need your help also. When I was in school, you had booze it or lose it, the drunk driving. You had click of the ticket. That was where your seatbelt. Only you can prevent forest fires. Just say no to. We had all of these campaigns, and the federal government funded them local, and these kids just don't have it now. When we think about any kind of disease, infection, virus, they actually are excited about the fact that there's a shot for it or there's an antibiotic for it. I was talking to a group of young folks, and their ideas about, any STIs, I can get a shot for. I was blowing my mind. Like, that was not my generation's thought process. When they thought about COVID, I can get a vaccine for it. So my quick question is, are we seeing young people more so in that demographic? And if so, like, what do we need to do? Because that kind of invincibility kind of sort of kicked us a lot in COVID. I don't want it to kick us in monkeypox.
Good question. Similar to COVID, Commissioner Burns, we see the majority of our infections being in that young and restless demographic. And that's those individuals who are in their late 20s to early 40s. And it's unfortunate that some are not taken serious. I won't say all, some. But we get a number of different scenarios, Commissioner Burns. We get I'm planning to go to Chicago, so can you give me my vaccine so I can continue to roll? To I'm about to just live my best life, so let me get this. And that's just putting it plainly, how it's coming to us. So with that being said, it's a different mind state at present, I guess, because they know that we have this vaccine, we have this thing that's curable, and folks is really instead of shunning it, they're just like all right, I got to keep it moving. To the point where from a personal standpoint, I am a doctoral student, and one of my classmates approached me and said, hey, I had it. I was like, really? And I mean, just cavalier, nonchalant, and I'm just like, wow, you realize how serious this is. So I think, it's hard, I don't know if I'm answering your questions, but it's just kind of hard to put into words the cavalier approach that's being taken. But these are serious times that we're in. There are a lot of people who are truly afraid, and the one thing that we don't want this to mimic or mirror is, the AIDS, HIV epidemic of the 80s. We're doing our very best to destigmatize, but at the same time, we're calling attention to how serious this is. For us to go from our first case, probably about within a month, to about 19, that lets me know that, it's out there, and we're doing our best to exercise this containment strategy. But until we're able to get vaccine in greater supply, we're kind of at the mercy of the CDC and the North Carolina Department of Health and Human Services.
Thank you, sir.
I have one quick question. How much of the news is true about surfaces that you can be contagious? So much of that is true.
Thank you for that question, Madam Chair. That question, too, came up at the town hall, and the medical experts pretty much said that, it's not, it can live on surfaces for a short duration of time, but it's not something to where you need to be armed with your Lysol and your Clorox, your Clorox wipes, and you need to wipe down everything. It's not that kind of party, Madam Chair. So with that being said, like any disease can live on surfaces for a short period of time, but it's not one of those things going to stay there and has to be decontaminated. I hope that answers your question.
It does. Thank you. Commissioner Carter.
Thank you. Thank you, Rod, for the good report, interesting report. Where are my glasses? Here they are on my head. Um, I just really wanted to say, first of all, that long COVID is still a danger and a threat. I mean, I do sense, I go around, with my daily life that people are really assuming that we're living with COVID now, and we're all going to get it probably, and it's not going to be that big of a deal because we're vaccinated if you're vaccinated. But we really don't know what all the long-term ramifications are of long-term, of the people who are suffering from long COVID. And I just read that's close to 10% of people who get it. So just that is a reason to continue to be as vigilant as possible. And I was wondering, in your work with state and the federal public health people, do you think we're making much progress on wastewater surveillance? Not necessarily just for COVID, but, in general, this is a surveillance strategy that probably in the United States we need to get really good at if we're going to contain future pandemics. And just wondering if you have had any exposure at the federal or state level to anything that leads you to believe we're making progress on that. And if not, I guess the question would be, is there anything we could do locally to make progress on that?
I think this board has been most supportive throughout the entire pandemic. I mean, whenever I think about my my long lost comrades, I mean, many health directors have retired. They're just like, okay, we're done. But it was attributed to the fact that they didn't get the support that they needed, or they just, waved the white flag, I'm done. So to that, I'm eternally grateful to this board for your support, continued support. To be blatantly honest, Commissioner Carter, COVID is still a priority. However, monkeypox, it's all about monkeypox right now. And we talk about COVID, it's almost as if the state is in a continuous battle rhythm when it comes to COVID. So we're excited about, autumn boosters, but at the same time, we know that it's one of those things, Commissioner Carter, where we feel as if COVID's going to be here. And, the only thing that we can do right now is to continue to stay prepared, continue to know that, the tried and true public health measures that's going to keep us safe. But we do not have one fail-safe cure for, for it to go away. And every meeting that I go to, every committee meeting that I go to, I'm listening. I'm reading. I'm, looking at, videos and everything. And, of course, my heart was like, my heart sunk when I found out Dr. Anthony Fauci is going to retire. It's like, goodness gracious, that's our hero. In him we trust. So we know that, we're in this battle for the long haul, and we just have to continue to keep our eyes on the prize, which is eventually one day this is going to dissipate. But as it stands right now, there is no real overwhelming strategy or new strategies coming forth. Just when we think that, it's going to go down, it just kind of creeps up. But, we just have to continue to stay positive and just do all the things that's going to keep us.
Hey, thank you so much, Ron, and, for this update, that you continue to keep us updated and look out for Durham County. We appreciate the work that you and your team do. So the next item, Commissioners, is 220494, proposed items for the 2023 NCACC legislative goals process. So the board is requested to review and submit proposed legislative items for consideration to the North Carolina Association of County Commissioners as the organization works through a rigorous process to develop critical legislative proposals to advocate for during the General Assembly session. And Deborah Craig Ray, a general manager, is at the podium to discuss it with you.
Good evening, everyone. Chair Howerton, Vice Chair Jacobs, Commissioners, and Manager Sowell. It's my pleasure to stand before you to what I feel like essentially starts your legislative walk as we move forward to the long session that will start in January. Just a quick reminder that every 2 years, you gather to suggest potential legislative items that have statewide implications that are used in the process as the North Carolina Association of County Commissioners crafts their legislative goals. These are the goals that we work on to build consensus and to achieve a unified message that the counties share with lawmakers in Raleigh. So that's really what our aim is. I'm just going to try to go through the items that you all suggested that we add as I started the process at your work session a couple of weeks ago. The first item I will just reference is full funding for the Leandro ruling. Seek legislation to encourage the General Assembly to fully fund the Leandro decision currently pending in the court system. I'm not going to read everything here, but I'm just going to mention that next week, actually, there will be oral arguments heard in the state Supreme Court on this case. And as you know, it's been going for in excess of 25 plus years. And the goal is to, of course, expand educational funding and make the platform or the playing field much more level across our state. So I actually put, instead of a name submitting that goal, I put the entire Board of County Commissioners, because I believe I heard that from each one of you as you were giving me your ideas. And so I hope you are okay with that one.
Yes. Yes.
All right. Next item, increase funding for the community college system. I believe this one came from Commissioner Alam, and she wanted to ensure that we fully fund or adequately fund our community college system. She was first suggesting that we focus just on Durham Tech, but I explained that in this process, our goal is to be broad, and so I hope that this would be sufficient to achieve that goal that she requested. Any questions? Okay. Next item, these are under the area of Health and Human Services. Seek legislation to increase patient safety in nursing homes. This came from Chair Howerton. I tried to sort of describe what we were seeking, basically to update guidelines to ensure safety and health programs for nursing homes and personal care facilities to protect the health and safety of the residents and to keep them protected from abuse and neglect. And I hope I represented what your goal was for that
Yes.
one.
Thank you, Deborah.
All right. Next goal, support increased state funding for women, children, and families. Again, this came from Chair Howerton. I just simply described seek additional funding to increase access to high-quality childcare, early childhood education, child welfare services, adult protective services, and guardianship, including grant funding to local health departments for critical services like maternal health, child health, and women's health services. And again, I think that just really goes along with the resolution that you all approved earlier in your meeting. And hopefully this is something that we will be able to move forward. Are you okay with this one?
I am. I guess I'm thinking, I'm wondering if childcare should be pulled out. I guess I'm reacting to there's that childcare is probably one of the highest lifted up areas that we heard at the conference, other than opioid. That there's going to be such a need for childcare.
So would you like for me to amend that description a little bit?
Yeah, just so that it really pulls out how urgent it is that we support that.
Okay, I will just pull that out and we can work on that offline. Next item, seek legislation to enable improved data sharing between certain agencies that assist individuals with complex health and behavioral health conditions who cycle between jails, homeless shelters, and other crisis services. And we essentially are looking to better coordinate services for people with complex issues that find themselves repeatedly in jails, emergency rooms, or homeless, improve data sharing between agencies that respond to such persons in crisis will allow the service providers to better connect them with the appropriate services and hopefully break the cycle of incarceration and crisis. And that came from Vice Chair Jacobs, and if you would like for me to work on that one, Commissioner, I'm happy to wordsmith that a little more.
You did a fantastic job, Deborah. And I will defer to Gudrun to just, if there's any tweaking that you think with that, that if you could just pass it on to Deborah, because, and this came up at the NCACC conference, sessions that I was in, which I talked about being on the Familiar Faces Initiative. And I had paramedics and people from all over the state saying, I want to be part of that. We need that. We need a template statewide. So I think there's going to be a lot of interest in this statewide. And I know it gets to the issue of HIPAA. And so if Gudrun has any suggestions, I'm going to defer to her as the expert on that. But otherwise, you did a fantastic job. Thank you, Deborah.
Thank you, and I will work with her to finalize this one, but if we're good with it in concept, great, thank you. Now we move to taxation and finance areas. Expand current legislation for the property tax homestead circuit breaker to eliminate the age requirement. And this is actually one that was on a previous agenda that did not make it through, but I sensed that we still had interest in that. And so I wanted to bring that back and make sure that you are okay with moving forward with it again.
Okay.
Very good, thank you. And that came from Vice Chair Jacobs. Now we move into general government. Increase state funds for economic development. This was submitted or suggested by Commissioner Burns. Continue to seek legislation to grow North Carolina's statewide economy through state investments, including public infrastructure funding, competitive incentives, and coordinated efforts with county economic development services. And Commissioner Burns, I don't know if I got completely what you were seeking, but I'm hoping I'm on the right street.
You are driving down the right street. We're in the same town, same city, zip code. I think the only thing that I would lift up, there is a joint select committee on economic development and global incentives, and I'm hopeful that we can request somehow in there to discuss the rationale for improving transparency in North Carolina's economic development policies from a global standpoint. I think we're unique in Durham that we do a lot of international business and international companies come here. And so it might be helpful for us to have that. And also kind of sort of build on 2 recent reports that came out so that we can look at trends and kind of sort of help reveal what our area needs the most. Because I think that we'll see some transferable information that might help us in requests for transportation, for our roads and so forth and workforce development. So those are like 2 requests.
All right.
But I know that's those 2 standing committees are looking at. But no, that's perfect. Thank you,
All right.
ma'am.
Thank you, and I'll make sure that I have you satisfied. All right. Next, support transit funding for urban and rural communities. support increased state funding for existing and new transportation construction and maintenance needs, and support legislation to ensure that the strategic transportation investment funding formula recognizes that one size does not fit all, and that projects in both rural and urban areas are prioritized and funding. And this one was suggested by Vice Chair Jacobs, and just wanted to check in with you all about that one. Transportation is critical. Thank you. Okay, support affordable housing for workforce/teachers. And this one was suggested by Commissioner Burns. Seek legislation to authorize local school districts and county governments to provide affordable housing for teachers, first responders, and other employees. And this kind of pulled together the initiative that we were trying to get through previously. We started with trying to just do schools, housing for school employees, but when I was communicating with Representative Austin, she suggested that other communities were trying to pull in a broader workforce description, and that we might be able to get it through that way, and that's just how I sort of amended it there, and I just hope it gets to the spirit of where we're trying to go. Commissioner Burns.
Yes, ma'am, and thank you for adding that one. And also special shout out to Representative Hawkins and Representative Austin, because they did put forth a bill in committee and in May.
They
And I
did.
think these suggestions would be helpful as we work to formulate it and also elevate what happened this last week with our joint school board county meeting, as we all work towards looking at our land portfolio, because the last thing we want to do is have this and not be able to move forward. So I know that we made a request from the school board. I hope we can get some of that, and they made a request of us. So it's all in alignment.
Absolutely. And I will just insert that I did check with the schools to see if they have prepared their legislative agenda yet. I spoke with the chair before we left that meeting, and they have not yet done their legislative proposals, but I will keep touch with them just to see where we are and where we can align.
So, Deborah, regarding the teacher housing, I understand from an attorney, it's in the schools, it's with the school's attorney right now. And speaking with the chair, she's supposed to be putting the document together for us to move forward with that. So I'm not sure where that would fit. I think it would be good to have a conversation with our attorney to talk about that one.
I'll just mention that this is
for
not
everybody.
Durham specific.
Right.
This is statewide, if that helps.
It's first, okay, statewide.
Yeah,
Okay.
it's for any of the counties.
And it does
can
say
use this.
county housing.
Yeah, we're not on our local bills yet.
Yeah, it would just be good for you to have the information about where we are with that.
Yes.
For the schools, so that if it's something that needs to be added, then it could be added. Hopefully, we'll hear from DPS to find out what's going on there. Is that correct, Attorney? Am
I had a
I missing
conversation
anything?
with their school board attorney last week, and they have not made any moves as of yet, but they know the ball is in their court, so they're not just looking at the county to run the ball, so to speak. The ball is in their court.
Okay.
Okay, so, you know, it's your decision whether or not you want to include it in this forum or not. So I defer to your decision, of course. The next item, increase the minimum wage, living wage for all state and local government workers. Seek legislation to increase the minimum wage for all state and local government workers. The increase can be aligned with current data that is as found in the North Carolina Budget and Tax Center latest report, and I think that number is now listed at $18.50, and of course that could change if I read the next report, but that's a place to start. So again, I was trying to just satisfy the request, and that one actually was suggested by Commissioner Carter. All right, thank you. Increased funding for broadband expansion. This one came from Commissioner Alam. Seek legislation to expand broadband infrastructure and enhance internet access for unserved and underserved communities. Support open access middle mile network and last mile projects to connect unserved households and businesses with local networks. Certainly, we know that there is a move afoot to enhance broadband in our state. There was money also included in the federal ARPA Act, and we are moving on that. But again, it was a request that we seek continued support, and I have crafted this proposal for your consideration. Right. Next item, area, justice and public safety. Goal title is Protect Election Workers. Seek legislation to make it a felony to interfere by force, violence, or intimidation, or by any physical act with an election official. This was requested by Chair Howerton, and I tried to find some similar legislation, try to keep it simple and easily understandable, and so I wanted to just see how you felt about that.
I'm fine with that, thank you. Yeah, I think it's something that we have to, I think all the counties are going to have to grapple with.
Thank you. Now, I will note that Vice Chair Jacobs sent another item, which is kind of similar, that I sent out this afternoon to you. And so we've titled it Legislation to Protect Executive, Legislative, and Court Officers. And essentially, it's legislation that would protect those who are not protected, public officials like as yourselves and others. And Danielle Briggs from the Attorney's Office actually crafted some legislation, and I also included that in your package. So certainly I'm not going to read the actual legislation, but the goal is obviously very similar to protect our officials. And so I didn't know if there was any interest or even a possibility of maybe trying to combine those two, or if we could keep them simple. And I see Commissioner Burns has her hand up.
Number one, I'm in full support of my chair and vice chair requesting this. I think just in Durham, period. I won't even opine on that, on what some of us have had to deal with, not even recently, but last year, even beforehand. My big question is, I do have Article 5A open in front of me. It does say legislative officials, executive officials, or court officials, and then you have to kind of sort of dig in to find out what is defined as an executive official. And if I'm not mistaken, because I can't pull it up now, I tried to pull it up this afternoon, we're considered in that group, if I'm not mistaken. And it already is a Class 1 felony. So I just want to make sure that we're asking for something that's new as opposed to something that already exists.
So I'll have to turn to Attorney Darby.
Yeah,
I
always thought we were a protected class, so.
I'll have to study that one. We'll get together and come up with a decision.
Okay. I'm in full support.
That's a good point, though.
Yeah, I hear you. And so, yes, if you're already included, that is one issue. Mm-hmm.
I would suggest consulting with Attorney Briggs because she's been working on this legislation with other attorneys across the state. Because it's my understanding that public officials there are gaps in the current statute that do not protect public officials of all kinds, including election workers, but court officials, anyone who is working in the public, who is a public official in different capacities. So, but I would suggest bringing in Attorney Briggs.
Yeah.
We will get together and get
Yeah, I just know that it's been an awful lot around Board of Election, elected folks that are working those areas, and elected officials across the country, so.
Yes. When we
think
were in NACO, I attended the large urban county caucus meeting, and
Yes.
they talked about, the Maricopa County Elections Director talked about what his staff had endured after the 2020 election, and
It was
how they had to
horrible,
harden
just-
their offices
yeah.
and other
Horrible
things.
listening to that, and so proactive, being proactive, I think is a thing that we're trying to do in North Carolina.
Understood, absolutely. Thank you.
Thanks.
So just two more. Amend gun safety laws. This was requested by Commissioner Carter. And I just wrote, seek legislation that aligns with federal gun safety regulations, work to identify evidence-based practices that decrease gun violence, particularly among youth. Again, trying to simplify it because you can go so far into the weeds that you really lose the essence of it. So I thought if we just kind of kept it pretty basic and simple, we might get more attention.
Yeah.
Yes, and I mean, I also think that you used language that might be more appealing, universally appealing than some of the things I would probably want us to put in there, like ban assault weapons, for example. But
Yeah.
I guess that probably wouldn't get very far in North Carolina. But who knows? Maybe that'll count as an evidence-based practice.
Right, and we will certainly attend all of these 7 committee members and fight very vigorously, get our pieces in.
Hey, Deborah, I also did just think, if there's any legislation that our own, members of our own delegation are championing, if we could pull the, especially with regard to this, I know Representative Morey has had the, what's it called, the red flag?
Red flag.
Yeah, the red, so, you know, we could maybe jump on that bandwagon and maybe, and probably that actually was part of the federal, so maybe it's included there already. I think. Hope so anyway.
Conceptually, are we okay? All right, thank you. All right. And the last new one that I have here is seek increased state funding for North Carolina courts, including funding for specialty courts and pretrial release programs. North Carolina has been underfunded and with significant deficiencies were identified during the pandemic. Increased funding would allow courts to enhance their operations and services to include personnel, improve broadband and supports. And I think in general, your board has almost every year requested increased funding for the court system, even locally. So I think this sort of goes along with where you have been on this issue.
Yeah. Cool.
Is there any other item that you would want to push forward now that I can work on and we can get this final list ready to go to Raleigh?
All right, what's your deadline?
It must be submitted by September 12th. That's their deadline.
So commissioners have a few more days. If it's anything else you want to put in the pot.
Yes.
Thank you so much, Jeff.
But remember,
Are there
you
any
must
other
vote.
questions?
You must vote on the approved
We need to
list.
vote on.
You have to
ones
vote
we
on the
have.
approved list.
Okay.
So
Are there any
whenever
other
we
questions,
finish,
commissioners?
we still have a work session.
Oh, do you want to wait till the work session, or do you want us to vote now?
That's your, I'm your
Why don't we,
staff.
why don't we wait for the work session in case there are some add, delete, or clarification? Okay. Thank you so much, Deborah.
And remember, you'll have to vote at a work session.
Vote to vote at the work session.
Right.
Okay, so I need a motion to vote at the,
No, not today.
oh, okay. I just want to know, be
To
clear
take an
what you're
action
saying.
at the work session.
Okay.
Yeah.
All right. Thank you
Thank
so
you.
much. Yeah.
And I look forward to getting your additional input.
All right. So commissioners, we're down to boards and commissioners, board and commissions appointments. Mr. Attorney, are you ready?
Yes, evening, board. You have 7 positions or commissions or committees to vote on or put people on. Starting with the Boxing and Wrestling Commission, you have elected Demetrius Smith. The Criminal Justice Advisory Committee, you have selected Miran Bahima. Hope I got that name right. To the Durham Cultural Advisory Board, you have selected Andrew Nurkin. To the Durham Planning Commission, you have selected Brandon Davis. And to the Durham Racial Equity Commission, you have selected Nisha Williams. To the Homeless Service Advisory Committee, you have selected Russell Pierce. And to the Library Board, where you can select 4 different people, you have selected Ann McMillan, Ida Stringer Standback, Miguel Jackson, and Willis P. Richard. Those are your selections.
Thank you, Attorney Darby, and congratulations to all the citizens that are appointed. We appreciate you. We appreciate your willingness to serve, as you help us to get the work done. So thank you.
Chair Howard, I had a quick question. And I don't know if I'm right. It wasn't until you just said the names. I imagine that at times when residents want to be on some boards, they might apply to the city and the county. In the event that they have been put on by the city and just have not been notified, and maybe we put them on as the county, like, what do we do then? Like, because we can't keep putting not same person on. I think there's somebody who's applied for both, and I could be completely wrong, but let's just say Racial Equity Task Force or JCPC, they applied on the city side and the county side, and we both made appointments in the same month, and we both appointed the same person. I know that's random.
If we appoint the same person to the same board?
Yeah, because they applied on the city side as well. They didn't know which side they were going to get on.
Well, they can only serve at one, they can't.
I get that.
Yeah.
So that's what I'm saying. So what do we do? Do we not make the appointment? Yeah.
Let Monica or the attorney answer for you.
You'll have to get with the city and that person will have to decide which one they want to serve on.
Right.
And someone will have to appoint another person.
I didn't think about it until you just read them, but I feel like I heard them announce that person already on that side like 2 weeks ago.
Yeah, normally,
I could be wrong.
Normally, if the city has appointed them, then they let us know. Monica will let us know that they've already been appointed. And we don't appoint them to the same board, but we could appoint them to another board. Okay, any other questions, comments, concerns? Okay, we are down to the end of our agenda. If it's nothing else, I will entertain a motion to adjourn.
I move to adjourn, Madam Chair.
It's been moved and properly second. Roll call by the clerk.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. We are adjourned 4-0. Thank you.